ملٹن کینز پاکستان کشمیر ویلفیر ایسوسی کی جانب سے سیلاب متاثرین کے لیے موبائل ہیلتھ یونٹ، راشن پیک اور خیمہ جات سمیت دیگر عطیات الخدمت فاؤنڈیشن کے حوالے کر دیے گئے، جو سیلاب زدہ علاقوں میں پہنچا دیے گئے۔ ملٹن کینز پاکستان کشمیر ویلفیر ایسوسی کا احسن اقدام، موبائل ہیلتھ یونٹ، واٹر فلٹریشن پلانٹ، سینکڑوں خیمہ جات اور راشن پیک الخدمت فاؤنڈیشن کے ذریعے سیلاب سے متاثرہ علاقوں میں پہنچا دیے گئے۔ آغوش یوکے کے صدر ڈاکٹر عدیل ریاض ان دنوں پاکستان کے دورے پر ہیں۔ انہوں نے نیوز روم پاکستان کو تفصیلات سے آگاہ کرتے ہوئے کہا کہ موبائل ہیلتھ یونٹ ایک منی ہسپتال ہے، جس کے ذریعے ولیج ٹو ولیج سیلاب متاثرین کا علاج کیا جا رہا ہے، جبکہ موبائل واٹر فلٹریشن پلانٹ کے ذریعے ہزاروں لیٹر پانی روزانہ کی بنیاد پر فراہم کیا جا رہا ہے۔
اس وقت میں مشرقی بائی پاس بیس کیمپ کوئٹہ میں موجود ہوں۔ میں اللہ تعالیٰ کا شکر ادا کرتا ہوں کہ اللہ تعالیٰ ہم سے خدمت کا کام لے رہے ہیں، اور الخدمت فاؤنڈیشن پاکستان کی طرف سے فلٹریشن پلانٹ کوئٹہ کے ان سیلاب متاثرین کے لیے تحفے میں دیا گیا۔ آپ دیکھ سکتے ہیں سیلاب متاثرین بچیوں کی بڑی تعداد یہاں پہ موجود ہے، اور پانی بھی بھر رہا ہے، جنریٹر بھی سٹارٹ ہے، اور الحمدللہ پانی فلٹر بھی ہو رہا ہے۔ تو میں الخدمت فاؤنڈیشن پاکستان اور اپنی پوری ٹیم کا شکریہ ادا کرتا ہوں کہ ان کے توسط سے ان کی خدمت کی جا رہی ہے۔
سیلاب متاثرین نے ملٹن کینز کی تنظیم پاکستان کشمیر ویلفیر ایسوسی کو عطیات دینے والے مخیر حضرات کو ڈھیروں دعائیں دیں۔ اس موقع پر ان کی آنکھیں اشکبار تھیں۔ انہوں نے اوورسیز پاکستانیوں کے اس تعاون کو سراہا۔
Message I'm recording specifically for our friends and colleagues in Milton Keynes, the Milton Keynes Pakistan and Kashmiri Welfare Association. So alhamdulillah, you obviously have cooperated a lot with us in this flood. So I'm here in Dadu district, deep in interior Sindh, and this is one of the worst affected areas of this region. And actually, another problem with this area is that because the disaster is so huge, that the demand is high as well. So that's why there's a bit of law and order situation as well. So all the other charities have left. So there are 24 charities here. So only Alkhidmat Foundation has left here. So this is one of our many tent villages. So there are about 1,000 people living here, almost 102 different tents. So in this tent, these 1,000 people, we provide them shelter, food, clean drinking water. So through MKPKWA, the charity dinner and the money we raised from this, so some of that is spent here in this tent village. The mobile water filtration plant visits here regularly, which your support was there, and the mobile health unit you sponsored us with. I actually wanted to make pictures with the mobile health unit, which is not at the moment here because they went 8 kilometers away to another village, but we are expecting that to come back, so we'll make some pictures for that. But at the moment we are in the village, so there are a few other obviously donors who supported Aghosh UK for this, but we are especially grateful to MKPKWA for their donation. And these little children, there are quite a few of them roaming around here in this place, so they are quite grateful obviously for the support you are doing, and please keep that coming, because this disaster is not going to finish anytime soon. So a few more months. So this village specifically is here for another 3 months at least, and it's been here already for the last 3 months. So keep on supporting them because they do need your help.
موبائل ہیلتھ یونٹ کن چیزوں پر مشتمل ہے، آئیے دیکھتے ہیں۔
So I'm standing inside a mobile health unit. So this is sponsored by Aghosh UK and our colleagues in Milton Keynes, MKPKWA. So this mobile health unit is an amazing facility, and it's a blessing for our flood victims. So this unit has been going around in the area. So yesterday, for last 6 days, it was in Khairpur district. Now it's in Sakka. So this mobile health unit is a kind of mini mobile clinic on a truck. So in the corner you can see there's a doctor sitting as a qualified doctor, and there's a team of doctors who are running around the clock in this mobile health unit. So the patient comes in through the reception, sees the doctor, who obviously would do the examination, all the related things that they need to do. And then we also have a mobile lab here. So this is a lab which most of the clinics actually would require for their routine work. So they do all the routine things like full blood count, checking kidney functions, liver functions, and they're also most importantly checking for malaria, dengue, hepatitis. All these tests are available in this lab. So the doctors would get the results, and then they'll obviously would provide all the necessary treatment. So this mobile lab is well controlled. We've got lots of point of care testing available, which is on this shelf, which we use. Antenatal care related tests are available here as well, because they interact with lots of females. Some of them are pregnant as well. They were telling us that yesterday they had 2 deliveries in a tent village. So these type of mobile health units are offering quite good services. The doctor was telling me that besides infective disease, they see lots of other disorders as well, elderly, the chronic diseases, but anemia is quite common as well. So the other thing besides the consultation rooms and the laboratory is the pharmacy in front of me. So pharmacy is equipped with all the common medications which one may require for these type of illnesses which these mobile health units would deal with. So this would be manned by a trained pharmacist as well who's present. So the staff, besides laboratory technician, doctors, the admin team, will also have a pharmacist available on site. So next to the pharmacy is a washroom which is used by staff and the patients, especially when they provide the urine sample, would be done in this washroom. So we are also fortunate to have an ultrasound machine available here as well. So it's a mobile handheld ultrasound machine. So the ultrasound at the moment is mainly used for antenatal and postnatal care, and for that they are arranging a female doctor to offer this service. So the ultrasound room is a separate room which provides a dedicated antenatal services mainly. So this is an amazing facility. So Alkhidmat Foundation has got 11 of such trucks, and Aghosh UK is sponsoring this truck. So one truck costs £55,000, and we are grateful for our donors in Milton Keynes who have donated this truck. So this is an amazing technology, and obviously next few months it's used for floods. But once floods finish, the need, especially in this area of Sindh and Balochistan, is immense anyway for these type of health facilities to continue from one village to another. So we'll show you some pictures from outside as well for this facility. But we are grateful for our healthcare team, our volunteers, our doctors and technicians, pharmacists, admin team who are offering this wonderful service. And obviously we are grateful to our donors who have enabled us so that we could offer this service.
साहिबजादा मोहम्मद सुलेमान खान, न्यूज़ रूम, पाकिस्तान, लाहौर.